Good afternoon, everyone. Uh, this is Keyur Australia, the host for this afternoon. We shall begin in a minute. We'll just allow a few more media to join in. So just bear with us. We'll just start in a minute. Thank you.
Shoo, 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 shoo. Good afternoon, Chairman. Namaste.
Namaste to
I
all.
wish we were all there.
Wish you all healthy, happy nation and the world. God bless.
Thank you, Chairman.
Good afternoon, ladies and gentlemen. Very warm welcome to the press on behalf of the Apollo Hospitals Group. Today, on the occasion of World Health Day, when value of good health is celebrated across the globe, we've assembled here to share Apollo Group's perspective of well-being and to gain insights into the importance of preventive care as the tool to keep the nation on the track of good health. The Apollo Group has been a pioneer in healthcare in India and for over 37 years ensured as much focus on preventive health as on curative health. On the occasion of World Health Day, we would like to share our perspective on the health of the nation and present an analysis of trends in India that we must take cognizance of and make clarion call to every Indian to prioritize their health proactively and everything else for a healthier, happier nation. We have with us today Dr. Pratap C. Reddy, Chairman, Apollo Hospitals Group, Dr. Sangeeta Reddy, Joint Managing Director of Apollo Hospital Groups. Along with them, we are joined with Dr. Anupam Sibal, the Group Medical Director, Apollo Hospitals, Professor Nirmal Kumar Ganguly, former Director General, Indian Council of Medical Research and President, Apollo Hospitals Educational and Research Foundation, Dr. Sujoy Kard, the Chief Medical Information Officer at Apollo Hospitals, and Dr. Satya Sriram, CEO, Preventive Medicine, Apollo Hospitals, to address the media. Before we ask the dignitaries to address a couple of house rules, I would request every media personality to please keep their audio on mute and video off. During the Q&A, we will give them a chance to speak. Uh, For the Q&A, we will request you to please mention your name and the publication that you represent. And in case you're not able to, ask the questions, we could type that in the chat box and I will ask on your behalf. Without any further ado, I would request Dr. Sangeeta Reddy, Joint Managing Director, Apollo Hospitals Group, to set the context of the National Health Report.
Namaste. On behalf of the Apollo Hospitals family and Apollo Hospitals enterprise, it is first my pleasure to wish all of you a very, very healthy, happy, and significant World Health Day. It is well known to all of us, and especially now after the year we have been through, that health is the most important aspect. Today we have got together to share with all of you, in a way, our commitment to the health of the nation, our interpretation of the work which is happening across multiple centers, multiple ecosystems within Apollo, to share and collate that into a perspective on the health of the nation, to highlight significant scenarios which are happening, things we need to be aware of, aspects we must take preventive care, and then as we move on, what we will be doing is really sharing with you what we believe is a potential solution for some of the major problems that we are facing together. So with this, may I have the first slide, please? So on this World Health Day, I think it is significant for us to all remember and recollect that in the General Assembly on January 24th, 2012, it was very well acknowledged that the global burden of disease was really significantly being overtaken by a new scenario called non-communicable disease. Countries in the world had fought communicable disease for so long, and it was now non-communicable disease, which were not just a threat to lives, but a potential future threat to economies of the world. And our chairman will tell you more about this later. But recognizing this, the government created a mandate and included in Sustainable Development Goals a very important aspect of focusing. And in this, I want to highlight, to begin with, just one very significant statistic. As you see the red and the blue lines moving, you will see the blue line is really death caused by communicable disease, which in 1990 was by far the significant factor for India. Sometime in the year 2002, the non-communicable disease overtook the communicable disease, and today 64.9% of deaths in India are caused by non-communicable disease. Today, as we showcase and highlight on World Health Day, the health of the nation, we recommit to the health of the Indian population. We want to re-energize everybody's focus on the social determinants of health, and we will be showcasing to you one project that we do in a cluster of villages called Total Health, and what the impact of focusing on this can be. We'd like to strategize on implementing the right interventions and really showcase through our team the paradigm shift from curative care to preventive healthcare. Next slide. Moving on, I just want to very quickly highlight to you that this could not have happened unless we had a history of serving the nation. In the last 37 years, we have tried to work across and create paradigms. When the country thought that advanced healthcare happened only abroad, we brought advanced healthcare to India. We continue to do 8 to 10% of the country's cutting edge work in cardiology, in nephrology, in cancer, and we will continue that commitment. But we want to take this one step further. By using cutting edge procedures, we will improve clinical outcomes. But by using artificial intelligence, big data analytics, risk prediction, by the analytics that we have done over 18 million unique health records, de-identifying that into over 17 million lines of code to create risk prediction and personalized care pathways. This is a unique, one-of-its-kind initiative across the globe, and this is becoming the anchor of the future of healthcare, which will be our perspective on the health of the nation for 2021. I want to acknowledge that this body of work is a combination and a culmination of records from the Apollo hospitals, from Apollo 24/7 and our online, from the personal health records de-identified, from the Apollo Education and Research Foundation, and the large number of screening camps and work we do in public health situations, in government hospitals, in mobile screening camps, in the Apollo clinics, Spectra, the diagnostics, and also significantly the medical colleges, as well as Total Health, which is our CSR initiative. Moving on to the next slide. I would want to say that Apollo has always been a pioneer, and over the years, we have come back to you time and time again, bringing robotic surgery, TrueBeam, the best CT scan. You know about ARC, and I'm not going to read that entire list of technology. All of you as media have been partners in this bringing technology to India. Today, we're coming to you with a different type of technology. We're coming to you with the technology of analytics, of artificial intelligence, of predictive algorithms, which when applied on data and put into population skill sets and used in a paradigm of prevention, we can change the way we look at healthcare. So with many thanks to our chairman for continuing to give us the dreams and the vision to innovate, to our data scientists, to our technology teams, and our doctors and clinicians, and our researchers for putting these ideas into place, and for our operational teams for saying that they will work on this new paradigm shift. I have great pleasure in welcoming all of you to the Health of the Nation report presented by all entities of the Apollo Hospitals Group on the occasion of World Health Day. With this, I'd like to hand over to next slide, please. But before I hand over to Anupam Sibal, I want to share this very emotive story with all of you, which is our journey in this concept of screening, early detection, treatment, and prioritization started many, many years ago when we did this in the district of Kadapa in Andhra Pradesh. And we conducted over 29 camps, screened 5,299 people, and found over 600 children who needed heart surgeries. 20% of those children were over 7 to 8 years of age. They had suffered through this for many years. And all of us know that the best time to correct congenital heart disorders is before they are 18 to 24 months of age. But we took this up as a challenge, and everybody came together, from the government to the public health system, to the hospitals, to foundations, to corporations. We found a way to treat these 600 children. But we also then went in and we trained the ASHA worker and the Anganwadi to screen children. So now we treat approximately 27 to 35 children from the same district. The backlog is not 600 cases like it was in that time. This is the power. And therefore, we are able to send these children by their 3rd year, 4th year to school to lead productive lives. So health screening, data analytics, integrated approach, early detection, prevention, and treatment is about keeping our country and our children healthy, our populations healthy, and of using the entire power of society to come together towards this. This is what Apollo Hospitals presents to you today. Over to you, Anupam.
Namaste. Respected founder chairman of Apollo Hospitals, Dr. Pratap Reddy, joint managing director of Apollo Hospitals and past president FICCI, Dr. Sangeeta Reddy, colleagues from the Apollo ecosystem,
Conference
and of course,
is being recorded.
Friends from the media from across the country. Good afternoon. It's a privilege to be able to interact with you on the occasion of the World Health Day. So where are we when we look at the country? And let's look at non-communicable diseases, and Mrs. Sangeeta Reddy just gave us an overview. So we look at dyslipidemia, and we look at the numbers, 42% in individuals between 46 and 60, 38% in those older than 60, and 29% in the younger lot of 31 to 45. We look at obesity and being overweight, 35%, 46 to 60, 32% in those older than 60, 24% in the most productive years of one's life, from 31 to 45. If we look at hypertension, 15%, 14%, 8%, and even in the very young population of 16 to 32%. And this is data based on our analytics of 1.5 million individuals, so 15 lakh individuals who came to us. And what we also have is dyslipidemia and obesity closely followed in the 31 and 45 years cohort. So 46 to 60 is where we have the highest incidence, but sadly 31 to 45 is catching up as well. And also in 50% of those with hypertension, we have dyslipidemia and 32% have diabetes. So you have three conditions, and we know that over a period of few years to a couple of decades, these can have very devastating consequences. If we look at pre-diabetes and diabetes, so pre-diabetes is to the left of the screen and diabetes is to the right. 46 to 60 years, the cohort is the highest. And this makes these individuals prone to diabetes and of course the complications. But the 31 to 45 year cohort, the orange that we have, is also very significant. And the prevalence of diabetes in the 46 to 60 year cohort is almost as high as more than 60. So we are really looking at a very productive population base that is getting afflicted with pre-diabetes and diabetes. And we all know the serious consequences of diabetes because it does not spare any organ system. In addition, about 50% of those with diabetes have hypertension. And sadly, when we analyze, 60% of diabetics are leading a sedentary lifestyle. And these are very huge numbers if you look at 33%, 30%, 35%, 32%, 31%. So really alarming figures here. If we look at women, and sometimes there is this sense of comfort that individuals have that yes, estrogen protects against heart disease, but let's look at hypertension, dyslipidemia, and diabetes. Sure, the prevalence in women is lower, 15% in diabetes as against 17, 8% hypertension as against 9%. In men, dyslipidemia 26 as against 32%. But see, the difference is not huge. So they're pretty close. And also after menopause, the risk of getting heart disease in women increases. Of course, when it comes to obesity, the prevalence, you can see here the difference is about 3%. Now, while I presented to you data of 1.5 million people who had a health check, but we also looked at screening a lot of individuals, factory workers, urban poor through urban health centers. And this is pretty substantive data. It's 367,306 people that were screened last year. And the income varied from 6,000 to 10,000, 10 to 20,000, 20 to 50,000. And of course, there was a significant proportion of those who were not working. And it is a mix of females and males. So if we look at pre-diabetes, it goes from 0.7% in the young to 4.5% in those older than 60. If we look at diabetes, it goes from 0.7 to a staggering 18% with 13.5 in the 46 to 60, but 18% in those older than 60. And look at hypertension, it climbs from 0.7 to 2.8 to 9 to 15%. So it's not just about people living in cities and having high stress jobs, but it is also about those factory workers and those who live under situations of extreme difficulty. We also had the opportunity of doing some work looking at highly sensitive troponin. And the idea here really was to predict based on the level and the cutoffs, and we have mild, moderate, severe, to predict the likelihood in addition of certain other tests of developing cardiac disease. So we screened about 13,000 Apollo family members, 7,350 individuals who had a preventive health check. We also have created a biobank where we have 33,000 samples stored, and we will be analyzing as time goes by these individuals that will be under follow-up to see what were the risk factors when we actually measured the HSN troponin, what were the interventions that we were able to introduce into these individuals. Is about lifestyle changes, about medication, including antihypertensives, about statin when indicated and longitudinally following these individuals to see what happens. If we look at cancer, and this is really a rather alarming slide. If you look at the prevalence of cancer, it's just going up from 1990 in 30 years. You just see how breast cancer has shot up. There isn't anyone on this call who does not know of a family member, a friend who hasn't got afflicted with cancer. If we look at top 3 cancers for women, they are breast, cervical, oral. For men, they are oral, colon, and lung. And breast cancer, we can pick up early through breast self-examination. Through pap smear, cervical cancer can be picked up. Oral cancer can be picked up through screening. But sadly, individuals come late. And while we might have the best therapy available, from precision chemotherapy to immunotherapy to bone marrow transplants to all kinds of minimal access surgery to ensure that the average length of stay is lower and the outcomes are good, to all the radiation therapy, fancy and sophisticated machines we have, to the only proton therapy center covering a population of 3 million for Africa, Asia, Oceania, at the Apollo Proton Cancer Center in Chennai. The concern is we have to focus on prevention, because when they come, patients come to us in stage 3, stage 4, no matter how sophisticated the treatment, the outcomes are not where they would be had that cancer been picked up in stage 1. COVID, of course, has totally changed the way we've lived life. And if we look at COVID-19 and Apollo's response, we had Project Quach, which is a 360-degree response from prevention, early diagnosis, quarantine, management in hospitals, management at home, in hotels through I-Stay, rehabilitation after you go home. Considerable amount of experience that we have garnered over the last 14 months. We've treated 125,000 patients with COVID. We've done more than 700,000 tests. We have 2,300 dedicated hospital beds. In addition to Stay I, 100 fever clinics, an AI-based self-risk assessment tool called on Apollo 24/7. We've changed our protocol 35 times to make them contemporary. And of course, we've published the second highest number of papers on COVID, 195 papers that are listed on PubMed Central that have Apollo consultants. But what I want to take 30 seconds with you and share our work with machine learning and some data analytics. So we looked at, could we predict the risk of dying at 7 days and 28 days by looking at 23 parameters, clinical and lab. And what we found is, what we did using sophisticated analytics is to calculate the hazard ratio. And it went from 1.2 to 3.9. So let me explain that. If an individual had diabetes, there's a 1.2 times risk of dying compared to someone who doesn't. 1.04 times with hypertension, 1.56 with heart disease, 3 times with chronic kidney disease, and nearly 4 times with chronic liver disease. And we found that those with heart disease are likely to deteriorate faster and they might die at 7 days compared to the others where it might be 28 days. So this is a very powerful tool that is just going to be published. And of course, our work on our approach was published in NEJM Catalyst. So using the AI work that we've done, so as you see this chart warm up, if we look at diabetes hotspots, so 16 million people took the Apollo 24/7 COVID scan. And this heat map represents 1 million responses. And you can see clearly that in Delhi NCR, Punjab, Haryana, Kolkata, Mumbai, Ahmedabad belt, in Hyderabad, in Chennai, and in Kerala, and certain rural pockets in Madhya Pradesh, UP, Bihar, Orissa, and Gujarat, we have a serious issue with diabetes. If we look at hypertension, and again, we look at this heat map that represents 1 million responses, we can see here a prevalence of 8.18%. And this is in Delhi NCR, again, Punjab, Haryana, Kolkata, Mumbai, Ahmedabad belt. We see Kerala, how it lights up, parts of Tamil Nadu, Chennai, Hyderabad, and then some rural areas in Madhya Pradesh, in UP, Bihar, Orissa, and Gujarat. So we have, friends, to summarize, a serious problem with NCDs, and we need to act and act now. And I think with the kind of technology that we have access to using AI, ML, we can really make some very powerful predictions, and more importantly, be able to have measures in place to prevent progression and to optimize management. I'm now going to invite Professor N.K. Ganguly, former Director General, Indian Council of Medical Research and President of the Apollo Hospitals Education Research Foundation, to tell us about the Total Health project that we have in Andhra Pradesh. Over to you, Professor Ganguly.
Thank you, Dr. Sebal, and thank you, Chairman Sir and Ms. Sangeeta Reddy for this opportunity. I will tell you the story of Aragonda, our Chairman Sir's birthplace, where a silent revolution took place on a health system reform which has never seen anywhere in the world. This is the community which had 27% anemia, which has got 7% people consuming alcohol, about 13% women chewing tobacco, as well as there was an open defecation of 42% of people. There was an obesity in women of about 11%, more than 29 BMI, as well as there was poor water supply and garbage collection. So this was the situation in this community. This community now, with the catalyst action of the Apollo group, participated in this revolution. So this was a health system reform where there was an active participation of the community. And this became one of the only rural the demographic disease surveillance system in India. There is none other, and very few in the world. There's the fourth such system in the total world, where every household health record data is available. This was collected through 4 very innovative systems, which is again something first. It was through household surveys, through mobile clinic, which could do the diagnostics with the biochemistry, and innovation was even HB1AC could be done at the doorstep. The third was the satellite clinic, which were 4 clinics in which people participated after they were diagnosed as high risk, and they could go and seek treatment and diagnostic. This was even before the Mohalla clinics came up and the Prime Minister's program came up. This was conceived, and this was a major innovation over there. And Ayush integration also occurred in this particular area. So if I want to compare it, the panel in the histogram shows you the Andhra Pradesh, because Aragonda is in Andhra Pradesh profile. If you see people below 40 years, there is almost same NCD and communicable diseases. It rose steeply as you reach 40 and above and 70 and above. The injuries were the major cause of death in people below 40, and it reduced. If we look at the participation of the various NCDs here, the major was the cardiovascular risk, that is 40%. 11% was cancer, 7% was diabetes, and the COPD was around 9%. So this is the Andhra profile. If I go to the Aragonda now, in the Aragonda, if we really look at this, there will be about 6.2% we found to be diabetics, in which 3.5% were newly diagnosed. And there was 10% hypertensive, where 12.5% were newly diagnosed. They never knew that they had this particular disease. There was a women's health survey of the cancer, cervical and breast cancer. Here a major innovation occurred with the Philips company. There was a colposcope which could be inserted by the nurse or even class 8 or 10 trained girls. And this threw out images which went to the caregivers, and they provided the major inputs of how to do this. And cryo surgeries could be performed on the site, and some were referred in this health system. The Chittoor Medical College was one of the tertiary referral center. I will like to say something that this was one of the major public-private partnership with Andhra Pradesh government. And yesterday, Mr. Alok Kumar of the UP government praised this. He had a discussion with Dr. Sangeeta Reddy, and he praised it in a group in which I participated, that they will follow this particular model in UP. So the cancer patients which needed to be treated, they were sent to Chittoor, and if necessary, were sent to Chennai. And this was totally free of cost. So this was a profile, and in this profile, about 1,980 diabetic and 35,350 people were divided into low risk, medium risk, and high risk. And they were followed up in these clinics and a 50-bedded hospital in Aragonda. Now, here, the major innovations were this, that they didn't have to spend, they had to spend only very marginal amount of money. At that time, it was 30,000 rupees insurance, and this was covered through that. But none of the technologies work if there is no social development index, which happens. So one very important innovation which occurred over here, that the system put money in the pocket of the women. They were trained by jute board for jute handicraft. They were trained for hospital apparels and the COVID masks and others. They were trained for sanitary napkins as well as the paper bags. And these were socially marketed, and the money they got from and bank account, and they got money in their pocket. And this became the driver of the growth and economy of this particular place. The children were educated in a school, very modern school, in association with Cytrus. And these, their adolescent children or grown-up children were trained by the Blue Star for refrigeration and other, and they got job. And the Tata Skill Development also trained them so that they got job. This was a mango growing country, and the mangoes were actually wasted. So here there was a partnership with the food processing. So the packing and food processing of mango occurred, and there were money in the pocket of the community. There was a sanitation, the water was provided with another innovation, which provided at least 25 to 26 liters of water to every household over there. Similarly, the sanitation was provided, which was an unmet need, and housing done India Awas Yojana housing was introduced into this area. So a total revolution occurred into this. But one major thing I will say before I close, and we'll say talk about few innovations. One major thing happened when this research was even not conducted. There was because you know the NCDs, the major driver is the low birth weight babies and preterm and extreme preterm babies. So we actually put emphasis on the women, and they were provided 600 kilocalories of the additional nutrition, which included egg, jaggery, and some dates, and they all sat together and ate this. And the system was set up for their care, and the delivery were effortless. There was no maternal mortality. IMR was almost negative, and the linear growth of children were maintained. This is a technology revolution which is happening now and is being adopted by the government of India as a major technology revolution. So now the resurvey is happening, and one major intervention which is happening with the partnership with the Bangalore Yoga University, where there are trainers who are providing yoga training and meditation training. This is one of the major lifestyle changes which is happening, and this has been a very successful ingredient. The community participation is very, very good. After seeing all these innovations, the other mandalas, which are neighboring mandalas, they actually approached Dr. Pratap Reddy that please teach us this. So this revolution is now spreading around. So I will close my thing with saying that we are not only this, we are creating a lot of new diagnostics liquid biopsy, the diagnosis of cancer through liquid biopsy. A major trial has happened for the triple negative thing with a peptidomimetic. We are having algorithms in which those who are not responding to anti-TNF alpha, etc., we are putting those things over. We have created an Indian brain map. So huge amount of other technology revolutions are occurring. It is not a forum to talk about that. It was a story of Aragonda. And with the chairman's blessing, we are going to a resurvey, and this transformation will perhaps create a new algorithm for the entire India. Thank you very much.
Thank you.
And now I invite Dr. Sujay Kaur for the next presentation.
Respected sir, thank you very much for the talk. I would like to start with the first slide with a question that how can we use technology to address India's health? And for us, the major objectives were to look at the data, analyze it for meaningful use with trust, with integrity, and then develop and validate clinical AI ML models, accurately predict individualized and public health perspectives in a longitudinal fashion. And then finally, what is the most important thing is to integrate with clinicians' workflow and individual's patient journey, providing alerts and notification in that way. I start by talking about the study that we are doing for the past 3 years. We call it AI CVD, where it is a multi-center prospective use of a cardiovascular risk code that we developed with past 7 years data. And when we looked at a prospective cohort who were coming for health checks in our organization, we found out that this is the picture that you see for females and males with hypertension, with hypertension and without hypertension. Now, one of the significant things that you would notice here is that people under the age of 40 years who have hypertension have odds which are almost from 4 to 8 times higher than people who do not have hypertension. The other focus area for us is what is coming out through this research is that isolated diastolic hypertension, people who are having their diastolic BP higher than 90. Because what we are seeing is that every time their diastolic BP goes up by 10 millimeter, what we are looking at is that their risk is increasing by 2.38 times. Moving from hypertension to diabetes and uncontrolled diabetes, what we are seeing is that there is about 2.5 to 3.3 times higher risk of cardiovascular event in 7 years, with increased prevalence of additional comorbidities like hypertension and dyslipidemia. Dr. Siebel talked about how these were actually affecting the COVID mortality, but we are looking at it from a CVD perspective, cardiovascular disease perspective. And you would see here people with no diabetes or controlled diabetes versus people with uncontrolled diabetes. And if they do not have concomitant hypertension or dyslipidemia, the risk is about 2.5 times. But when they have all three together, and I want you to focus on here, it goes up to 3.3 times. The next in the line is actually the thing that Ganguly sir was referring to. It was about the use of tobacco. Now, we always associated smoking with cardiovascular disease and chewing tobacco with oral cancer. But what we are finding in this particular study is that chewing tobacco is as hazardous or as risky as a behavior as smoking, and particularly in elderly ladies. And this is what we are finding through our study. They have a multiplicative effect of almost 2 times of having CVD event if somebody is using tobacco, either smoking or even chewing tobacco. Now, from cardiovascular, I want to move into the antimicrobial resistance pattern. And this is something which we are looking at after about analyzing 106,000 isolates from 2019 and 2020 from our different hospitals. I don't think there are parallel studies across the globe at this point of time, which is looking at this extensive data set. And if you look at here, what we are observing, that the drug resistance organisms are not only prevalent in the hospitals, but they are prevalent in the community and increasing at a rate of 4% every year. Whether it is in terms of MRSA or whether it is in terms of ESBL or non-fermental carbapenem resistance, we're seeing a very similar trend with that. So what we have been able to do is start an antibiotic stewardship program in Apollo hospitals to look at the patterns of this drug resistance and reduce their prevalence using syndromic approach, like an approach towards community-acquired pneumonia, and using recommendation system AIML tool and complying to what we call as the WHO AWARE program. But the focus of the program is to go and talk about it into the community and improve the community awareness. I want to go into another visualization, and this is the work that we did with across India. And I'm just showing you two cities where we mapped the ICD-10 coding system, which is the diagnosis of the patient. And here you can see chronic obstructive pulmonary disease with their PIN codes and merge them together to get the valuable data or information of where these patients are coming from. And we are also looking at another aspect, like where they're using the inhalers by using pharmacy data. And then on taking all of these data set together, we look at the air quality index and build models which will predict if somebody is going to have acute exacerbation of COPD or asthma. And this is something that we have now rolled out into our ProHealth as well. There are other works that are going on, in particularly AIML usage in radiology. We are detecting intracranial bleed on the CT scan within 30 seconds and alerting the radiology. We are now able to extract coronary calcium scoring from standard CT scans and say about cardiovascular risk or somebody developing coronary artery disease. During the COVID time, we detected and highlighted lung abnormalities typical to COVID so that radiologists can report these X-rays quickly. Moving ahead, there are multiple clinical APIs that we are developing within Apollo hospitals. We talked about the AI CVD risk score, which predicts the risk of CVD in the next 7 years. And then I talked about the asthma or the ACO complex, which predicts the acute exacerbation. We have a model which actually talks about liver fibrosis detection, looking at fatty liver and diabetes. And then, of course, I talked about the infectious diseases, where we are recommending empirical antibiotic for OP, IP, ICU, and ER. One of the important aspects of each one of these is they are all validated across different international institutes, which are working as our partners. And then we have work that are there in pre-diabetes scanner. We have work that we are ongoing with heart failure, breast cancer and mammography. This work comes from MIT. We are one of the Indian centers. We are one of the world centers, in fact, only Indian center, who are working to validate this model and, of course, work on stroke risk. So if you look at it in a nutshell, they are developed in-house, integrated into EMR and the workflows. They look at individual patients' risk profiles and connect them to condition management system or clinical pathways, and more importantly, provide the current way of doing patient education. With this, I would like my colleague, Dr. Satya, to take over.
Thank you, Dr. Sujoy. It is truly my privilege to share with you this afternoon how we're going to shift the paradigm in India from a curative to a preventive mindset. As a country, we really need to accelerate this early identification and management of NCDs. You see here on the graph, the solid blue line, the probability of dying between the ages 30 and 70 from any NCD. And if we follow our current path, that's where we will end up in 2030. That's not sufficient. Every one of us needs to take charge of our own health, of the health of the people around us and our communities, in order to accelerate this path so that we're able to meet the sustainable development goal that we've committed to as a country, but more importantly, our responsibility to our families and to our nation. How are we going to do this? we actually built on the learnings of the total health case study that you heard from Professor Ganguly and piloted in 2019 Pro Health, a very unique, personalized, proactive health management program. This program is empowered by artificial intelligence and predictive algorithms. It builds on Apollo's pioneering efforts in preventive healthcare, 22 million health checkups over 37 years, and draws on the medical experts who have been involved in these health checkups and who are committed to making you healthier. There are three principles and pillars that ProHealth is built on. First, predicting your risk. Every one of us is unique, and we have a personalized health risk assessment that takes into account your medical, personal, family, and environmental history and identifies and predicts your risk for NCDs. And coupled with AI-enabled risk scores for various conditions, this then becomes your health pulse, benchmarking your personal health against others like you. The second pillar is about preventing the premature health events. Here, what we do is actually personalize the health goals along with your physician, who takes all of the different factors into account and tells you what will actually make the most difference. And we support you through that path to wellness constantly. Finally, the third pillar on overcoming your chronic lifestyle disease. Our learning from Total Health says that if one is committed to that path, then it is indeed possible to reduce the risk over time, as long as one is diligent and stays the course. We analyzed a subset of ProHealth guests over the last 12 months who had diabetes and followed their path to wellness. What we found is across a number of health parameters, as well as behavioral changes, there was a 30 to 60% target achieved by this cohort. So the program can work as long as one is committed and stays on that path to wellness. Let me bring this to life with a case study. We had a 65-year-old female who enrolled in Apollo Pro Health in October 2019 and went through the personalized health risk assessment, and the health parameters and diagnosis was a combination of diabetes, arthritis, hypertension, and dyslipidemia. The guest also complained of knee pain. The AI cardiac risk score was 9, indicating a moderate risk for someone of that individual's history and age profile. Over time, the individual committed to a holistic wellness plan along with the physician and incorporated several aspects, including relevant diet, weight reduction, appropriate medication, yoga, and lifestyle changes. All of this was aided by a meticulous follow-up by health mentors as part of ProHealth, and also the knee pain was taken care of through a specialist consult. Over 12 months, what you see on the right is a reduction in this individual's health parameters across HbA1c, sugar levels, weight, and BMI, essentially reducing their risk from where it was 12 months prior. This is the ProHealth promise. I'd like to invite our chairman to please share his vision for an NCD-free India.
Wish you all happy World Health Day. Sangeeta, Dr. Anupam Sibal, Dr. Ganguly, Sujoy, and Satya have all clearly mentioned saying the data proves that there is another huge crisis that's impending on us. The 2020-2030 World Economic Forum almost 10 years ago projected that NCDs will cost almost 80% of the deaths world over. But what we have been trying from that time, especially over the last 24 months, we've been working very hard to say, from our previous example, You know, everybody knows Apollo has been number one in curative medicine. But little did they know that we were working silently but very positively on preventive health. This is where we diagnose what's called the master health checkup then to find out why should a person get a heart attack? And especially as I don't know how many of you know, that Indian heart attacks occur between 30 and 50, as opposed to the Caucasians between 60 and 80. When I presented to them, American Cardiology, they told me, Dr. Reddy, the Indians don't know the date of birth. I said, don't be foolish. They not only know the date of birth, they know the stars under which they are born. Then one day they realized in 1982, 7 years later, that six doctors didn't get up from the duty room. All of them were Indians. Then hell broke out, and then said, they did study. First they said Indians eat a lot of ghee. And then they said they eat a lot of coconut oil. I said, they not only eat coconut oil food, but they also rub all over the body, but they don't get increased heart attacks. And now everybody prescribes coconut oil for improving your brain power. So I think this myth that Indians get heart attack early is now very clearly proven. Even 25-year-olds, 30-year-olds are getting heart attack now, similarly with the stroke. So I think the fear of whatever they have instituted, saying by 2020, 2030, 80% of the deaths will be from non-communicable diseases. What are these non-communicable diseases? Diabetes, hypertension, cancer, infections, and obesity. Now, of course, we added mental disorders to this. So I think the cardiac risk is the highest in all of these individuals because this is what causes the pain and grief in a family. Because who is this 35-year-old? Who is this 30-year-old person? He is the one who is the breadwinner. He is the one who is contributing to the welfare of the organization he is working. They are the people who are working for the GDP of the country. So I think little attention has been paid from these three angles, which really should make individuals to think, say, what can we do? How can we transform? How can we stop these NCDs killing 80% of the disease? It's possible. It is possible because I think Satya very clearly showed, and Dr. Ganguly beautifully brought out our total health program in the village I was born. We adopted 65,000 people from the first breath to the last breath. We have clearly shown when you monitor, when you advise them, when they get used to listening to you and adopting what you say, these can be reversed. You still probably will get a heart attack at 80s, but not at 35, not at 30. So this is where I think a great importance must be given on World Health Day. I wish the media spreads it to the world so that news gets to the people saying, there is a way for me. Yes, I have diabetes, I have hypertension. I don't have to suffer from a heart attack or a stroke. And the cancers, if detected early, previously cancers were death sentence. Now we are very clearly have shown that if you detect the cancers early enough, you can cure it. Even in my village, they detected last 2 years about 18 cancers, 11 in women, 7 in men, all operated. So they are cancer-free. So cancer is no longer a death sentence. Even the major conferences that took place in Chennai, when we opened Proton, they clearly said cancer is curable. But what is needed is early screening, early detection, and cure. So I think there is a lot of message that we can give on this World Heart Day saying, world has to be should be a better place, not a place which will grieve, leave alone. You know, the World Economic Forum said the world will have to spend $30 trillion to treat these NCDs, and India's burden is 3.8. I've been trying my very best last 20 years to see that the government spends 3 to 5% of the GDP as against 17% of US, but nothing happened because they have other priorities to do, but they are trying their very best to say, now they are promising it will go up to 2.5%. So I think the financial burden is one side because the family, as far as the family is concerned, the member's presence, their family member is more important. I think this is a big thing that we all need to do is, can we create whatever we have done in the 60,000 people for the 6 billion people? Can we ask this question? I'm asking the press to say, project this and say, if we can do miracles, inventing newer and newer weapons, you must invent this weapon which can cure your health. So I'm very positive that it can be done. And I think the world leaders, the people must think saying, my priority is my health. I think that once that gets in, unfortunately, priority is health sometimes. They do a lot of exercises, they do all of this, but they don't know the state of the health. So what we have created, this word called Pro Health, is out of the 22 million health checkups that are done, thanks to the artificial intelligence, they have brought in a checkup which is individualized, personalized checkup, and a permanent record. Your record forever will be on our Apollo 24/7 at any time that you want. I think this is where the Pro Health will make that significant impact if the person wants to see that he wants to stay healthy. So all my one single word is stay healthy. On a World Health Day, take that challenge, saying I can stay healthy. I don't have to see the consequences of diabetes or hypertension and or cholesterol or any of these risk factors, but I will stay healthy by doing this Pro Health, finding out your state of health, and then say, these are the various things that I will do to stay well. God bless you all. I love you all.
Thank you. Thank you very much, Chairman, sir. There were kind words and quite a few insights on the World Health Day. Thank you, Dr. Sangeeta, and all the speakers who've been sharing some interesting data with all of us. I would now request a short AV to be played before we get into the Q&A session. Can we have the AV, please?
We at Crossroads. The fight against non-communicable diseases is the greatest health challenge we face today. Almost all of us know someone who has suffered or died from heart disease, cancer, lung disease, or diabetes. Non-communicable diseases kill more people than any other cause of deaths worldwide. This includes 6 million people who die each year in their most productive years, with vast majority of them being premature deaths. It's time to drive ourselves to make critical choices. Do we take the road to a healthy future by improving detection and screening for conditions like cancer, heart disease and other ailments, and providing healthcare for all and ensuring people are well enough to work and support their families and communities? Or do we continue down the same imprudent path? Despite the fact that these diseases are preventable, the number of NCD-attributed deaths are increasing, and increasing everywhere as demographic changes offset the decline in NCD mortality rates. This trend cuts across all income groups, globally from low-income countries to wealthier nations. We are enduring and living through extraordinary times. The global outbreak of COVID had an adverse effect on our work towards a healthier world. More so, it has made a definitive assault on the vulnerable NCD population, engendering enormous fatalities. And Apollo, being the vanguard of healthcare advancement, has taken this crisis head-on. it has taken the pledge to not only treat but to decimate NCDs. With the experience of over 22 million health check over 4 decades, Apollo has redefined the preventive health management with Apollo Pro Health, a unique AI-enabled personalized health management program to combat the tsunami of NCDs. Using latest technology in biochemical, radiology, genetics and analytics enables us to predict risk of somebody becoming sick. Early warning symptoms, lifestyle modification, appropriate medication helps understand the risk factors and prevent them. Personalized path to wellness aid to overcome small problems swelling into bigger issues. At Apollo, we are working towards envisioning a world where cancer is only a birth sign. Blood pressure is only read as beautiful people. Sugar levels are seen only in kitchen jars. Stroke only in cricket matches. Imagine a world where fat burns faster, where calories are never counted, and age is only a self-limiting physical quantifier. This is the world free of NCDs that we have envisioned with Apollo Pro Health.
Thank you very much. We will now open the forum for the Q&A session. I would request the media to raise their hands so that we can line up the questions. In case you're not able to, for some reason not ask the question, you could type that in the chat box and we'll ask. Sure. We have Mr. Baleshwar. So go ahead and ask your question, please. Mr. Baleshwar, are you able to ask the question?
Yes, sir.
Yeah.
First of all, I appreciate this program, a very good move. And my question to Chairman, Dr. P.C. Reddy, sir, is that, he said cancer, early prediction of cancer is curable. Yes, right, this is what has been widely said about. But as an hospital, it has been for the last 4 decades, what is your testing, procedure for cancer in your regular general health checkup? What you're currently following up, or do you have any other separate checkup for this cancer prediction earlier stage? Because if it is detected in earlier stages, certainly the patient will come forward. The biggest problem with cancer patients are that they are getting symptoms, and only after when they come to the second or third stage, and then they come to the doctor, and the doctor says we are on the third or fourth stage, so may not be curable and all that. So can you please put a here, something for our people to understand and for us to also take it forward to the people at large?
Thank you very much. I think it's a wonderful question. It answers the entire gamut of cancer. First, let me say, I use the word saying, if cancers are detected early, what we call early means stage 1, stage 2, it is curable. But what patients do come to Apollo most often in stage 3, stage 4, where all the gamuts of therapy that we have to use them and perhaps save them. But as I said, if they undergo the checkup, or sometimes they detect themselves. We have taught the ladies what's called the self-examination. During the self-examination, if they feel that their tumor, if they come to us, it's a very simple procedure to remove the tumor before it has spread to other place, makes her live a normal life. So I think in almost all cancer, we concentrate when we do this Pro Health. Previously, Apollo Health Check. Today it's called Pro Health. In Pro Health, the doctor and the investigations are all geared to see that if they have cancer, at whatever stage it is diagnosed. If they are diagnosed in stage 1, stage 2, the cure is 100%. If they diagnosed stage 3, stage 4, yes, we have all this chemotherapy, including one of the world best proton therapy center. So that is needed only for stage 3, stage 4 patients. But your question is, if everybody is aware and if they go for preventive health checkups, and certainly all of them can be detected first. There are diabetes will be detected, and the control is mechanism is told, and if they follow, that will not hurt the body, because diabetes bites from head to foot. Similarly, the hypertension, they very clearly showed the hypertension and diabetes in my village. They all of them, people who did not know diabetes, when went through the checkup, they found out diabetes, hypertension, and if they are controlled, the complications of cerebral hemorrhage, heart attacks, and stroke, none of these will happen. So I think that's a good question. Please advise everybody to be conscious of their health, because you have a very precious body. I'm very fond of saying this. It's not my quote. One of the professors from New Haven, he said, each one of our body costs $6,000 trillion. Please remember this. If you have a body which is $6,000 trillion, you have a car which is 6 lakhs of rupees, you service it regularly. But I think 6,000 trillion body needs a checkup once a year at least. And this Pro Health is something where it not only detects your problem, also gives you a health record for life. Thank you.
Thank you, Chairman, sir. We have Mr. E. Kumar. Sir, you can go ahead and ask your question. So are you able to ask your question, Mr. E. Kumar?
Yeah, I hope I'm audible now.
Yeah.
Yes.
Yeah, see, very important. Thanks, I think, for brilliant presentations, actually. But as you noticed, actually, this NCDs, we've known for a long time that 60% of all deaths in India have been generally around 60% due to NCDs. I just want to check in the context. We are in terribly very challenging times. So how has the last year's pandemic played a role? How is yours, since you've done a study? How has the increase in NCDs happened during the pandemic, and the current round, which is a rather vicious round now, how is that playing out? At least your early findings of what's happening. And second point is actually, how do you see the impact of this now going forward? Because the staff, the infrastructure has its own, it's thinly spread. So you have COVID beds as well, so you'll have to redeploy. Footfalls will apparently also fall. So how much of an impact on NCDs as a result of what's happening currently is expected? And finally, which is saying what you have said in mind in terms of Pro Health, great initiative. How much do you expect in a year from now? Let's say, what's the goal in terms of where do you want to get to? 3 points.
Anupam, would you like to take the question on COVID and NCD?
Sure. Thank you for that. It's a very important point that you raise, and this is something that we struggle with every week. We've seen individuals with cancer where they were scared to come to a hospital with COVID and a lump was ignored. And if that lump had been picked up, and as Dr. Reddy said, corrective surgery initiated, we wouldn't have had the spread that we have at presentation. We've seen that with cancer, we've seen that with heart disease, we've seen glycosylated hemoglobin increase because the sugar checkups didn't happen in diabetics. We've seen patients with hypertension not get their checkup done, and which has resulted in a stroke. So what has happened is that non-communicable diseases, which really are so important, because of fear of COVID and because of the apprehensions that people have had, and I have to take this opportunity to reassure everyone that hospitals such as Apollo Hospital have an iron curtain between COVID and non-COVID. There is no crosstalk. There is no question of even crossing paths when you are in hospital. So this fear is unfounded, but unfortunately, because of this fear, we have seen that NCDs have taken a backseat, and we are seeing serious consequences of the NCDs being neglected, which is really worrying us. We saw this happen last year, but then when the COVID numbers started to decrease, patients got the confidence, and we hope that patients continue to have that confidence that their health is supreme. This life is priceless. It is hard to put a number in terms of a percentage we would be able to quantify in terms of NCD being neglected. But one thing is very, very clear. We see this every day across our entire ecosystem of conditions that we should have managed 6 months ago coming to us now.
So no estimate in terms of how is the pandemic impacted NCDs? We have been 18 months into it.
I can just say that the numbers have increased considerably, but you would have to do this on a population-based study to actually look at the data we shared with you about 1.5 million that we have reviewed over the years, and we see 17%, 12%, 13%, 18%, 32%, diabetes of up to 35%. So because of the COVID, to hold COVID responsible for a particular percentage would be really difficult to quantify. But what we can definitely tell you from on the ground, that the numbers of those who should have come to us early and have come to us now, and that has increased considerably. And that's the worry, and that's the message that we want, hopefully through your good offices, to be disseminated, that please do not ignore your health needs.
Okay.
Thank you, Dr. Subal. The next question is a couple of questions from the journalists are about ProHealth. So is the program live? That's the first question. And how can they enroll in it?
May I take that question?
Sure, ma'am.
Yes, the program is live. A couple different ways to enroll. You can enroll at any of our Apollo units, hospitals, clinics, spectra across the major cities in the country, as well as online on Apollo 247. You can choose ProHealth. So it is available for anyone to book appointment at our units.
Thank you, ma'am. The next question specifically is with respect to ProHealth again, but it's about PCOS in women, and that's considered to be one of the NCDs in the growing time. So how can ProHealth help here is a question asked.
So we've begun the ProHealth programs with diabetes, hypertension, liver disease, and so forth, and we are expanding now to women's health, and it's our next focus. You did say POCS or did you say PKD?
No, PCOS.
PCOS, right?
Yes.
So we are expanding to women's health as well, and then over the next couple of months, we will have a women-oriented ProHealth.
However, in the current, just adding to that, in the current dispensation, all ProHealth would then narrow down to a particular problem, and there will be a solution finding path to that. So a referral to a gynecologist and then the ability to treat that would solve the PCOS. And as we know, 1 in 3 women actually suffer, and most of them suffer in silence. So coming in for a generic health checkup and solving the underlying problems is really the crux of ProHealth.
Sure, ma'am. Thank you. The next question in line is about, there's a question particularly from Sneha Shah. My question is about polycystic kidney, genetic disease. So why is there an issue and the sector is not working on it? And what's the issue with the transplant in India?
Let me take that one. Polycystic kidney disease is an uncommon condition. We do see individuals who develop renal failure. Sometimes we have a combination of polycystic liver with polycystic kidney, which results in fibrosis and portal hypertension. So we need a liver transplant and a kidney transplant, and we have done combined liver and kidney transplants. doing kidney transplants for polycystic kidney disease that has resulted in end-stage renal disease is not an issue, given the fact that we do close to 1,000 kidney transplants a year. But this is something that it is an uncommon condition, and perhaps we can chat offline on the specific case that you might have in mind.
Oh, thank you, Dr. Subal. The next question is again about a personal, consultation that someone requires in ProHealth. That's from Roma Gupta. Roma, if you could reach out to us, it's about endometriosis patient, stage 5, and wants some help from Apollo with respect to ProHealth. So I would request Roma to please write to us, and we can connect you to the right person.
Pure, if I might just add,
we've made a note of your name, Roma. One of us will get back to you. You don't have to write.
Thank you.
Okay.
Thank you, ma'am.
If I might add, for endometriosis, now we've been really looking at robotics as a way forward in robotic gynae surgery. So, it's always a challenge in terms of invasive surgery, but with robotics, it kind of changes the equation. So just wanted to park that as well.
And we actually have the country's largest series in this treatment modality.
Thank you. Thank you. Sneha has just a follow-up, that is the ProHealth program available for kidney disease?
You want to take that, Satya?
Satya, or shall I?
So again, ProHealth is essentially, we'll look at your risk factors, right? And many of the NCDs tend to be asymptomatic, can be, but based on your family history, your medical history, environmental history, plus what we believe at your age you could be at risk for, it will diagnose, or at least throw up a set of investigations and consults that are required based on that risk. And so if kidney disease does throw up, then we do have, as part of that program, we will be able to at least address that issue if it comes up.
Thank you. Thank you, ma'am. I do not see any more questions related to NCDs or ProHealth or with respect to diseases. There is a question from Abhishek, and I would request Abhishek from Cogencies to write us to us separately. These are questions specifically on business front, and we'll be happy to answer that offline, Abhishek. So you could write to us. We'll reach out to you separately on that, Abhishek. Is there any approximate ranges of ProHealth packages that could be shared? Is a question from Ashwini Naik.
Currently, it ranges from rupees 5,000 to about 13,000. So that's the current price.
Thank you, Dr. Satya. One of the questions is, how do you think this report can help influence the government policies containing NCD disease burden?
See, the governments, the various health ministers, I remember when the first UN discussed on NCDs, our health minister went to New York. They discussed saying that they will do, follow a pattern, how to diagnose disease early. But I think they had so many other problems in healthcare. They are not able to unveil that complete screening of the entire world population. I think if that happens, you can eliminate NCDs completely. So our idea is individual must take, don't wait for the government to do it. I think the individual must say, my health is important. I quoted you the price of your body. If that is true, you should take some interest and say, let me go for my health check and then find out how well I am. If you are completely well, you should be very happy to maintain that wellness. If there are some problems, as I said, any one of these, we have now ways of detecting various diseases. And once that's detected, the cure is not difficult. So I think it should not rest it completely on the government. They are doing several programs for the welfare of people, but I think individual also must participate to have his personalized health check.
Thank you, Chairman sir. Is the Pro Health packages and Dr. Satya covered under insurance?
See, insurance covers, I'll take that. Insurance covers their annual checkup for 1,000, 2,000, whatever that is. But way back when Honorable Health Minister, I got a ruling saying 5,000 rupees exempt from tax for your health check. But unfortunately, nobody is using this. You know, in your checkup, you get tax reduction. But very few know about it, and even if they know, they are not using that thing. So there is a reduction, tax reduction on 5,000 rupees for your checkup, and for elders it is different.
Thank you. Thank you. This is about statistical reporting. I mean, the method for this survey done. I think Dr. Sujoy could answer that. How is this entire study being done? What is the statistical modeling for this study that was undertaken?
Am I audible?
Yes, yes, sir. Yes, sir, you're audible. Go ahead.
Right. Sorry. Yeah, so the different statistical modeling that we used in this particular presentation, or the kind of work that we've done. One, of course, is the visualization that we use through the typical Power BI or Tableau or other reports. Our AI models are built on either R or Python, TensorFlow, PyTorch, and all of that. The kind of things that we normally do in statistical modeling is that, first of all, look at the very basic statistics, look at propensity matching when we are looking at different cohorts. And then, of course, we move on to building algorithms, which starts with very basic models at the time and then goes up to the extents of deep learning and all of that. That's the structure that we follow at Apollo Hospitals.
Thank you, Doctor. One of the questions that we received on chat, is this report comparable to global standards?
Can I take that?
Yes, Dr. Sujay, please go ahead.
Now, if you look at it, many of these studies that we have talked about are being published or are in the process of being published in the peer-reviewed journals. And, and these are very extensive, high-index peer-reviewed journals we are talking about. Dr. Sibal talked about the Energy and Catalyst. We're looking at the Nature scientific reports and others. And BMJ, where we are getting it published pretty regularly. So, these are definitely global standard reports.
If I can add, I want to add two things in this. One is that we need to keep in mind that what we have presented to all of you today is a series of different cohorts. One in analysis of preconditions and therefore the propensity to further illness. The other is a population study. And each one of these, so for example, in total health, the WHO STEPS methodology of data capture was followed. As Sujoy spoke about, we've worked with Microsoft in the AICD. We've had our breast cancer algorithm validated and partnered with MIT. So in the summary, there's about 465 million lines of anonymized code extracted for relevance from summaries or data captured. And this is in an overall from about 21 million unique patient records and correlating to 600 different disease conditions. It is that extent of data which has then been culled into easily digestible, actionable insights for clinical care. But these are also being used in a series of other things. We're looking at it from Symptom Checker, which is on our health app. We're creating a back-end clinical intelligence engine. So I think the extent of knowledge of anonymized data of scientifically captured data being extracted to create clinical insights, and then presenting it today to you, one analysis or one view of this data is from the perspective of how it affects the health of the nation, how you can look at prevention through the health check, and how AI has been used. So a health check, and I want to reiterate this point so that for the benefit of the country, 5, 10, 15, 20 lab tests is not a health checkup. What you see in ProHealth, which is first a proactive, which test you need to do based on your patient history, which is AI enabled. Then you do the checkup, which is not only lab, but multiple others from stress to echo to ECG. Then you do the analysis of these reports with the doctor, and then you create the path to wellness plan. This is the proposition which can truly handle or control non-communicable disease to a significant level.
Right. I add on, Sangeeta ji, on what you said.
Please, Dr. Ganguly.
So actually, this is a unique effort. I don't see, and normally these are government-aided or academic institute-aided efforts. This kind of effort where even a village as a unit data is not available in India. And secondly, the normative value, all these labs results, when I was ICMR chief, it was presented that create a normative value so that we could use it in health indices. And it was so costly that we couldn't do. The Apollo published the first normative data of our country. And this has added on to that. And these normative data are helping us to really address it much more better than we were doing before. Thank you.
Thank you. Thank you very much, Professor Ganguly. Thank you, everyone. I don't see any more questions currently in the chat. And so on behalf of everyone, I would like to thank the leadership team and all the doctors from the Apollo team. Thank you, friends from the media, for joining us on this important announcement. We'll be sharing the press release shortly. In case there are any more queries, you can get in touch with us with the AdFactors team, and we'll be happy to help. Thank
and
you.
I'm sorry, there is one question seeking how you can get an online consultation. So ProHealth is a different program. Please just log on to 24/7 and you can get the online consult. Okay.
Thank you, ma'am. Thank you.
I see that in the chat box.
Thank you. Please be safe. Thank you very much.
Yeah, take care, everyone. Happy World Health Day and stay safe. I think this is probably the only health conference in many months where we haven't really spoken about COVID, but COVID is still amongst us. So please take care and take care of yourselves. All the best.
Thank you. Thank you very much.
All the best.